Hi everybody, it's Marie Fell, the Pilates physio here. I just want to do a run through, a quick talk with you about the pelvis, in particular in pregnancy, and how to feel and find your pelvic floor muscles, because I know a lot of people struggle to feel their pelvic floor and find it and then understand how to work it, particularly in a functional way, which is really important to us when we're pregnant and when we've got little ones at home. So I have a lovely pelvis here, which I will just take the organs out or they'll fall out. There we go, that's what you don't want to happen. And just to show you really how strong the pelvis is as a structure, it's a ring, so you can see the circle here. And when we're pregnant, it's a brilliant structure. It's so strong and stable. It's designed well to carry the baby due to its strength. So there's a lot of misconception that your pelvis can get quite unstable during pregnancy, and that's not really true. Yes, the hormones have an effect to help the pregnancy to, the pelvis to allow the baby to come down through the birth canal, but it doesn't fall apart very easily. The only way you'll break this baby is by falling off a horse or getting kicked by a horse or something. Like severe trauma is the only thing that tends to snap this ring. It's very, very stable. So please be reassured that your pelvis is an amazing structure and it's perfectly designed to carry your baby. So what are we looking at here? This is the pelvis from the front, and then if I turn it around, you've got the pelvis at the back. This is your tailbone, your sacrum, that you might also have been heard of, and your coccyx is a little bone at the bottom, and then your spine going up the back here, your lower back here. So as you can see, the red fleshy bits here represent your pelvic floor muscles. So they attach all the way back to the lower back, your tailbone and your coccyx, and then they come all the way through to the front, slightly upside down, isn't it, to the pubis bone, which is your front of your pelvis here, the pubis here. So you can see as well in between the obturator here that you've got the muscle inside of the pelvis. So if I just turn it this way, you can see it's like a bowl, and it's not just a sling hammock that runs front to back. It comes all the way up the sides inside your pelvis. So it's like a big hammock and almost like a bowl. So imagine it like coming around the inside of your pelvic wall as well. It doesn't just sit front to back like a lot of people visualize it or explain it to be. So why do we talk about pelvic floor in pregnancy, and why is it important? It's super important because the baby obviously sits here in your pelvis and has a direct pressure down through the pelvic floor. So your pelvic floor is going to act a bit like a trampoline. When something's sat on it, it's going to weigh down a little bit and get heavier and lengthen to allow baby to grow. And it does that perfectly. It knows exactly what to do. As these muscles get sat on and lengthened for 9 months, then obviously they can become prone to a little bit of weakness, particularly if we don't know how to strengthen the muscle. It is a muscle, so it really does need working. Like your bicep, it needs to contract and relax. Really super important to allow it to do its job properly. So it's got 4 main roles as a pelvic floor. Here, if you can see, the tiny, tiny, tiny outlet is the bladder. Then we've got the vagina, and then we've got the back passage. So the 3 holes here in the woman is what your pelvic floor, one of the jobs it does is to control the outlet of urine, feces, and a baby, or a penis if you're having intercourse. So it's got a sexual function, which is what this middle hole does here, but it also controls the passage of urine and feces coming out of the passages, keeps them in, keeps them up, and allows us to delay going to the toilet if there's a big queue at John Lewis or wherever you're doing your shopping, to hold that liquid in, or poo. So it's got 2 main roles there. It also has a brilliant job at help protecting lower back because it attaches directly to your lower back. It can help reduce lower back pain. So anyone suffering with lower back pain in pregnancy or in general, pelvic floor exercises should be administered and taught to you to help reduce some of that load. So those are the main roles of your pelvic floor in terms of what they do. Now, obviously, it's really, really common that 1 in 3 women will experience incontinence. So incontinence is when you can't control the bladder or the back passage and you can't keep your wee or your poo in long enough to get to the toilet. And the most common incontinence that we know about, that women complain about, is stress incontinence, when you cough, sneeze, laugh, jump, and a bit of wee comes out. So this is often to do with an increased abdominal pressure, and it has to go somewhere, and often it comes down out through the bottom of the pelvic floor. So when you're pregnant, your pelvic floor is the floor of your pelvis and your abdomen, and then your abdominal muscles are lengthening to allow the baby to grow, and then your back can often feel like it's coming into this position because the weight of the baby literally can tilt your pelvis forward, so the back can get that increased curvature through the lower back. The lumbar lordosis can increase. And then the other thing to be aware of when you're pregnant is your diaphragm, so your breath in and out. Your pelvic floor and your diaphragm work together. So when you take a lovely breath in and your diaphragm expands and allows the air to fill into your lungs, then the pelvic floor also moves down with the diaphragm. And when you breathe out and the diaphragm pushes the air out, the pelvic floor moves up and away. So breathing in, we get this action. Breathing out, we get this action. A bit like a piston, they move together. They're synergistic. So this canister is really important when you're pregnant. The top, the floor of it, the diaphragm, the bottom, the pelvic floor, the front, the abdominals, and the back, the spine and the spinal muscles. They form a canister that allow us to work our core synergistically. Now, obviously, as your abdominals get lengthened, your pelvic floor is getting flattened and stretched, your diaphragm's going to get pushed up out of the way as baby grows in your abdomen, and your spine can get pulled into that kind of increased lordosis in a lot of people. The lower back tends to curve more. Then obviously it throws out the mechanics of your canister. So we need to really teach ladies how to work their pelvic floor, how to feel it, how to find it, because it's easier said than done. Okay. The other reason that it's really important that we teach pelvic floor is because, as I've explained about, the 1 in 3 people will lead to incontinence. Also, 1 in 3 ladies that have had 1 child or more can lead to prolapse. So if you've not heard of prolapse, it's basically where your internal organs of your pelvis can descend down and south and out. So this can be the bladder, it can be the uterus, it can be the bowel. The chicken's going for it at the top as well there, but the pressure, again, thinking about the abdominal canister, there's too much pressure there, it has to come out somewhere, and this can lead to that dragging sensation lower down. Now, ladies can describe prolapse as a heaviness. It can be worse towards the end of the day. It can feel like a pressure down below in the vagina, or just a heavy feeling. It's not common that you feel everything dropping out, but it can feel like things are hanging down, and it's not a nice sensation to deal with, but it's common postnatally through pregnancy. You can also get prolapse without being pregnant, to having a severe cough. So anyone that smokes or anyone that has a respiratory condition, that constant coughing can really put a lot of pressure through your abdomen, so that can cause prolapse, as can heavy lifting with poor technique, so like breath holding. So, you know, ladies that work in supermarkets, for example, stacking shelves, or heavy weightlifting in the gym, that have not had children, that are wetting themselves or feeling that pressure in their pelvis, is caused by those things. So let's talk about pelvic floor muscles. So regardless of whether your baby comes down and out through the love tunnel or up and out through the sunroof, your pelvic floor is going to be lengthened for 9 months. So we all need to be doing pelvic floor exercises regardless of how your baby is born. So how do we do them? So we know through evidence and research that if we activate the muscles from the back passage, squeezing the back passage closed, there's a lot more muscle here, so we're going to get much more activation through the pelvic floor. It used to be taught that you stop yourself having a wee and you pull it up, that imaginary wee in, and that's not how we encourage pelvic floor to be taught anymore, and there's evidence to support that in the guidelines. So the NICE guidelines recommend that every pregnant woman knows how to do their pelvic floor exercises and do them 3 times a day. So let's talk about how, because that is tricky. Okay, so what I want you to think about, when you're sitting, it's super important that we're not sat slumped like we do when we watch the telly, and we're not sat too upright, we're kind of sat on the sit bones. So these are your sitting bones here, we want to sit up on them so that our pelvis is in a neutral position. Really important, not like that, not like this. Okay, and then we want to visualize the back passage. And the best thing to do is just imagine you're in a room full of people, or someone that you want to impress, or your boss, or anyone that you would not want to let wind in front of, or fart, as we call it. You want to imagine your back passage squeezing closed, and then imagine pulling that wind through and into the pelvis. So if we think that we're in this position, think about your back passage here. You want to imagine that you're squeezing closed that back passage, so drawing that passage in, and then pulling that imaginary wind through the back passage forward into the pelvis. So, have a little go now. So you can imagine yourself stopping, having a fart, squeeze your back passage closed, and then draw that imaginary wind kind of forward towards the pubis bone. So squeeze that back passage in and forward. And then just try and relax it and let it go. And it's really important we fully release and relax and lengthen the muscle, because there's a lot of ladies out there that are stressed and tense, particularly at the minute. And we know the shoulders come up when we're stressed and tense. That also happens in the pelvic floor. The pelvic floor muscles can squeeze up. So it's really important we relax and let go too. Okay, now we also want to think, so when I teach the pelvic floor, I always cue it from the back passage, but we also want to think about the middle and the front passages as well. So I tend to always start at the back and then we'll cue round towards the front, imagining that hammock coming forwards and through. Your middle passage, you want to feel a bit like you're pulling the tampon up and inside. So again, we go for the close, a bit like you're drawing a drawstring purse close through the vagina, and then imagine drawing up towards the belly button sensation. So it's always the first thing to think is the close and then the lift. So a nice way I like to teach my ladies is I get them to open their hand and we like close the hand together to feel the sphincter muscles drawing in, and then we lift up away from the entrance. So that can help as well. And then also allowing that passage to descend and relax. Now when we move to the front of the pelvic floor muscles here around the bladder, here you can see these bits. A lovely way to teach this, it sounds very strange, but imagine you're a man and you have testicles, balls hanging down. We're going to draw the nuts to the guts. So again, we try and think about squeezing the bladder closed, but we try and imagine that lift up towards the belly button here. So nuts to guts, testicles to spectacles, however you want to visualize it. Imagine you have balls and draw them up towards your belly button, and you'll really feel it. It helps your brain to engage with the muscle. So it's that lift that you want to feel at the bladder. Not really a clamping down and squeezing that way and stopping it. We want to move away from that. We want to squeeze and lift. And then also we want to relax those balls and let them go, descend away from the belly button. So if we put that all together, we also incorporate the breath with our teaching, because remember the diaphragm and the pelvic floor work together. So this is super important, but this is where it throws a lot of ladies out. So I just want you to take a lovely breath in, take a breath out, relax. And then again, take that breath in. And then with the out breath, relax, but try and squeeze your back passage now and draw that imaginary wind forward into the pubis. So you can lift up through the vagina and then draw the nuts to the guts. So you're coming back, center, forwards in terms of pelvic floor activation. Now try and count out loud to 5 or say it, but don't hold your breath. So I'm still breathing and my pelvic floor is now lifted. And then I'm going to relax the nuts from the guts, the middle passage, the back passage, and really lengthen, soften and open. And again, you might need your hand here just to go and lengthen down, because remember, we're all a bit tense and tight at the minute and we need to just let go. Okay, and then once you're fully relaxed, then you would repeat that. So ideally we should be doing 10 repetitions, holding for the up to the count of 10 seconds. So you can count, start at 5 and build up, and then relaxing. And when we're pregnant, 3 times a day we should be doing this. Now we also have fast twitch muscle fibers, the ones that work fast. So if you cough, sneeze, laugh, jump, we want the muscles to be able to act quickly. So to do that, again, thinking about your pelvic floor, think about the muscles working as one. And this time it's a much faster, stronger contraction. So ideally we would breathe in, and as we breathe out, we'd squeeze everything in and up together as tight as we can, and then release, relax, lengthen, and let go. So every 1 second we draw up, we relax for at least 4 to 5 seconds as we come back down. If you do it fast, you're just going to squeeze up, keep going, and then the muscle isn't relaxed enough. So you've got to really do the lengthening bit in between the fast ones. So 10 fast squeezes, 3 times a day as well when you're pregnant. And then we should be carrying on this after we've had the baby and for life as women, because this pelvic floor ability, muscle strength, contraction, relaxation, if it doesn't catch up with you post-baby, when you've just had baby and you're not peeing and you're fine and you get back to running, when you hit menopause, your obstetric history may catch up with you, and then you may end up with the prolapse at that point, and that's when it can affect the majority of women. So please look after your pelvis in pregnancy, look after your pelvic floor post-baby and for life. These exercises are quite simple to do once you master them. It's just making the time for it, and we're all busy. We're all so busy. So it's just teaching you quick strategies and helping you to feel it, find it, and work it. So I hope that helps you with your pelvic floor, how to feel and find it. If you're really struggling, another nice little tip to know of is that the abdominal muscles that are your core muscles wrap across your tummy. They come all the way around from the pelvis, from the spine, and wrap all the way around the front of your abdominal wall, all the way up to your sternum, all the way down. So it's a big sheet of muscle. Imagine a corset like the olden day people used to wear. They used to have that brilliant corset, suck them in. These are your natural core stability transverse abdominal muscles. So if you place your fingers on your pelvis around your hip bones here at the front, and then just walk your fingers in slightly, so that if I just do it on my body, and if I stand up I'm probably going to disappear, but let me just show you. If you rest your hands here on your hips, come in slightly here, so rest your fingertips there. And then what you want to do is imagine you have two little magnets here on the side of your tummy. You're just going to draw those magnets in towards the middle to meet each other. So it's kind of like you're drawing that corset into the middle. We don't want to be potentially sucking back and in. We just want to be drawing the muscles together. Because when I suck back and in, I tend to use the upper abdominal muscles, the big six-pack ones, and I want to use the corset ones that wrap around my body. Another way to visualise it is that you're wearing a low slung belt like we all did in the 90s, those thick belts that wrapped around our hips. Imagine you're drawing that in a couple of notches. So you're just drawing those tummy muscles in slightly. That will also help you connect your pelvic floor. So if you're really struggling with your pelvic floor, try and work on drawing the lower abdominal muscles in, because they're connected by fascia, bits of connective tissue and skin. It all connects together as a system. It's absolutely fascinating when you look into the body. But if you can work the lower tummy muscles, the pelvic floor muscles will work together. Remember I said they work as a canister at the beginning. It's all synergistic and it all links together. So if you're struggling with the pelvic floor, try the lower tummy muscles. And again, you want to use your breath. So we take that lovely breath in, we relax, we breathe out. And then we take the lovely breath in, and then we gently draw those imaginary magnets together, or feel like you're tying that low slung belt in a bit, or imagine you're walking to the sea and it's cold and you go, draw the tummy in gently, but you're pulling it into the midline, not the midline into the spine. So it's really important you get that kind of visualization. Having your hands on your tummy can help. Again, you need to keep breathing as you're keeping that tummy drawn in, and then you relax, release, and let go of the tummy and really allow it to soften. Your belly should go completely soft when it's relaxed. It shouldn't be tense or tight. And you can practice the tummy exercises, again, for 10-second holds, up to 10 times, 3 times a day if you find the pelvic floor just can't get it. Some ladies just can't feel it to begin with, so it's important we try and get something working to help you out. So I hope that gives you a little bit of core, how to do it, how to feel it, how to find it, how to work the breath with it. And then just really important functionally that you start to work it in everyday life, because we don't just walk around with it held and then relaxed. When we're functional, like lifting the baby up and down, or breastfeeding or anything, or sneezing or coughing, the pelvic floor should kick in unconsciously. But if you activate it and strengthen it, it will work a lot better into your advantage. So just the nice little tips to think about is that when you're picking your baby up and down, if you've had the baby, that you're not breath holding, because remember the breath holding is not good for the pelvic floor, it's bearing down. A bit like when you cough, the pressure goes down and out through something. So again, we need you to be able to activate those muscles when they need to. So by practicing it the way we teach it, then you can incorporate it functionally and you can be aware to use it. So if you bend down to get something out of the dishwasher and you know your back's a bit sore, then try and activate your pelvic floor muscles as you stand up and lift. And breathe out as well with the effort. That's super important, because that will all help the pressure on your muscles and help prevent things like leakage, prolapse, backache, and sexual problems. So please, if you're having any discomfort or problems with your pelvis, do seek out a pelvic health physio. You can find them online through the squeezyapp.com. There is a directory on there. And if you're struggling, then obviously you can reach out to me if you need to, and I can help you point in the direction. I have a website, www.mariefellthepilatesphysio.com, and I'm happy to help signpost you if I can. So thanks very much for listening, and I hope that helps you connect to your pelvis and your pelvic floor. Bye for now.